So, Dr. Manglona, thank you so much for taking time to speak with us this morning. As we were chatting earlier, you were talking about DPHSS, the Department of Public Health and Social Services, ability to test specimens and how you guys have expanded on that. Can you speak to that a little bit?
Sure. Early on in March, we had very few kits. I think we had about 20 per shift that we would run, and it was taking about 6 hours to run the 20. Things have changed. We've expanded our capacity at the lab. We now have 3 platforms running. We're planning to expand and add another platform, which will crank out more tests. We've collaborated now with GRMC, GMH. We've put Abbott ID Nows in many of the clinics to help. So the community is working as a whole to get more testing done.
And for the sake of our viewing audience, ma'am, you talk about the 20 lab kits. Can you expand on that? Because it's not just, they aren't 20 individual kits. There are a number that are inside each kit, yes?
Actually, no. When we first started, we had 20. And so there were a lot of complaints. Nobody was getting tested. That's all we had. 20 kits for 20 people. And if one misfired, it would take 2 kits per person. So that was early on. Now we're running 200, 300, 400 a day. The outlying clinics are stepping up, and they have their platforms too, maybe a little slower than ours. I think they can run about 3 per hour, but it helps. Every little bit helps. And with 7 clinics out there and other facilities testing, it helps the overall numbers. So that's less of an issue now. What we ran into recently, we have a daily capacity, as does anything. There's a daily limit. If I told you that we usually have 1 flight coming in at 7 o'clock and I call JQ and tell him, hey, we're going to bring in 50 flights, 40,000 people, 7 o'clock. Let's see how he handles it. It's a, you can overdrive our headlights with the number of tests. So we knew there would be a bit of a delay, and we aren't running all the tests out. I mean, we are running the tests. That's not true. DLS helps too. But the individual clinics also stepped up, and they're calling the patients that they swabbed and helping out. So, well, we were able to manage it. You never know how many will show up. And if it's a large number, it extends the days. But again, we're getting new equipment in, new machines in. So as we evolve, we will have an even greater testing capacity. Now, let's talk about the testing. I've heard a lot of people say, gee, I had my test done a week ago and I haven't gotten the results, and I could be positive and I'm out spreading it. Okay. So what that says to me is you thought you were at risk for a deadly disease. You decided to get tested, and then you went out and did whatever you wanted until you got the test results. I don't know what to do with that. Because if you took a pregnancy test and they said you'll have your results in 7 days, would you then go out and drink a gallon of bourbon every day and say, well, you didn't tell me the test results? Be responsible. Do what you would do as if you were positive. Do what you would do as if the people around you are positive. Do what you would do if you thought you were pregnant. Be responsible. Don't look to someone else and say, well, I went out and spread it because you didn't tell me quickly enough. Really? I can help you with the test and I can teach you about COVID. I cannot teach you personal responsibility and personal liability. So even if you're positive and you go out with a mask and socially distance, we still have a good shot at you not transmitting that disease. If you're going to socially gather, you're on your own. And we've seen it. Look at the numbers. Another thing too, people on the mainland, it takes 3 to 5 days to even get their test results. We've spoiled Guam. They were getting them in 1 to 2 days, and they have no idea how lucky they were to have that. They've grown to expect that. Go to Hawaii and get a test. Go to Texas. It's a whole lot different there. So anyway, I know you're trying to ask a question. What's that?
Well, to be fair, I know that a bunch of people who've gotten tested, they were told that their results would be phoned to them within 3 to 4 days. But you know, some of them had to wait longer than that. So, you know, and it's, I think there is that level of frustration. I can hear it in your voice as well, because I know that DPHSS is doing the best it can, given its resources.
Well, and given the unknown numbers, so when we open up
Right.
testing, how many are going to show up? 10,000 or 200? So I can tell you the days better after I know the numbers coming in. But I don't care if it's 20 days, 100 days, or 1 day, shut down. If you think you're at risk for a deadly disease, stop what you're doing now. That's the message. And then don't say, well, you didn't tell me, so I killed 10 people. I infected 20 because you delayed. Act like you're pregnant. Don't drink.
Okay, fair point. I think there's just on the community side, people are also just not sure what to expect sometimes, especially when they're told 3 to 4 days. So, I mean, but your point is well taken now.
More showed up. How can we control that? We're told not to shut down. We don't. We test everyone. The outreaches were supposed to end at noon. They're still standing there at 5 o'clock. They didn't want to turn anyone away. And so they freeze the specimens. They're preserved. So no foul.
Can we speak to that? Can we speak to that? When you freeze the samples, is that preserving the samples?
Okay.
Yeah?
It's okay. No problem.
And how long do the samples last?
In a freezer, quite a while, but we don't worry about that because we run them within a week, so it doesn't really matter. But freezing it stops everything. They're preserved.
Okay. So on the other side of the testing, you have folks who are tested. You've had a number of people who've been tested because they were identified through contact tracing.
Correct.
The governor, in her letter to the Center of Disease Prevention and Control and Prevention, said that there are 56 contract tracers, and that there's more. Can you tell us, kind of like how you did with the machines, how many did we start with at first of contact tracers, and how many do we have now? And how are we expanding beyond the 56?
I can get you that numbers. I'm not the team lead for surveillance. That would be Annette Uggan. She can give you the exact numbers. I cannot.
But there is an effort to expand that, yes? And we've got,
yes.
I'm hoping more
yes.
than we have now, or we had when we started. Okay.
How many do we need? How many do we need, though?
Well, that's the question.
It depends on the cases. And so how many cases are you all going to keep handing us? You know, if the community does what they're supposed to and they hand us 0 to 3 cases, we're good. When the community does what they're doing now, changes the game a little bit. We're at the mercy of the front line. The front line is the people. So you tell us what you all plan to do, and we can adjust accordingly. But I can tell you this, early on, some research did a study and said, who has enough contact tracers? And we were one of the top 7 for per capita or for incidence of disease, but we're at the mercy of the community. Let's not make any mistake about that. If they do what they're supposed to do, we can contain it a lot easier. But if you go out and cause numbers like this, what do you think that does to us? And I just, you're all the front, the community's the front line.
Right.
And it's like I said yesterday, kick it around. How do you think they're doing? The front line is dropping the ball. We have equipped everyone, every clinic. The governor has done all she can do. Finally, the kids were naughty and she had to say, stop.
Well, at the end of the day, Doc, folks have to work, folks have to shop.
It's closed down. It's closed down. Well, if they're being responsible, we wouldn't worry about it. They're not being responsible. I could show you photo after photo they get sent to us saying, where do we report this? These cases are from breaches. Whether it's work or play, these are breaches. So go to work, but don't breach it. Go play, but don't breach the protocols. We wouldn't be sitting here having this radio show.
Well, there are people who've taken precautions, but they, you know, it's as has been said many times, it's a very infectious disease. So, you know, at some point, there you might be susceptible to it, even if you've taken, you know, as many precautions. The precautions themselves.
Our contact tracers would differ with you. We sat down and tried to think of one person who had a case where they did everything. We are hard pressed to find a name with that.
Can you explain what everything is? I mean, because short of staying locked up at home, I don't know how to avoid contact with.
Mask, social distance, and wash the hands. That message has been there since day one. And actually, you said it, stay at home. Right now, that's the order, stay at home. You won't catch it in your house. If less people bring it in, you won't catch it. And we've had people infected because it was brought in. Don't trust anyone. If you're at home, wear a mask. Anyone coming in your home could be carrying it. And it's everywhere right now, and you have to realize that.
Right, and there's no doubt that it has, since those first flights that came in with passengers who had the coronavirus, we've seen it grow, definitely. But in light of that, I mean, how long do we stay locked up? How long do we keep the shutdown going?
The shutdown's up to the governor, but I can tell you this. How long do you all keep surging? How long do you keep breaching? The shutdown comes when the breaches occur and the numbers surge. So we're step 2. Step 1 is that. So my question to you is, when do you plan to adjust that? When does the community step up, do their part, and get us back to the 0 to 3 we had several months ago? So we follow your lead. If your lead is breaches and surges in number, then we take action. So my question would be to the front line. When does that stop? When do we go back to the 0 to 3 when people were very compliant early on? Everyone let their guard down. The community relaxed, and so the numbers surge. So my question for the community is, put your guard up and don't relax, and then we can answer our part, because we're number 2. You're all number 1.
Okay, so going back to number 1, folks who are we're looking at last night we had what was it? I forgot the number, sorry. But we had more than 100 again?
136 last night.
136 last night. So we had 136 cases last night. These could be traced to activities about approximately, what, a week ago?
I don't know. That depends on the contact investigation. We'll get those numbers. We unleash the detectives once this starts. And you can imagine that each person generally has 10 to 15 contacts. Let's do the math. So 136 times 15, average number of contacts. We're looking at 2,040 contacts. So the work begins. When you have one case and we have the tracers out and the surveillance team working for 15 people, 30 people, a lot different than 2,040.
Right.
And that's just overnight. Yeah. What about the day before? The 140 cases in 20 hours, it was over 2,000 contacts. So you're looking at a team that's supposed to investigate 4,000 people in 2 to 3 days. Do the math.
So in light of that, because we've had the 104 cases that we had over the weekend, there was another day where we had 105 cases. I think that was August 14 or something. You know, we've been seeing these increases. Have there been additional people who've come into who you've pulled in to do the contact tracing? And also,
yes, we've had to hire more, and we're using platforms too for following. We have some digital platforms. We have another one coming out as well, and there's a team lead for that, and you might want to have them on. They can explain that more. But we have video and tracking monitor systems, either already in force and one coming.
So can you explain how they work?
You need the team lead for that. I can't give you all the details. I know the one that's already in force, they put an app on their phone and we do video conferencing with them.
Okay. Is this the one that was discussed earlier in the year?
There have been several. The one we're using, the one that's already in force is the AMOCA, but Path Check is coming. There are different Sarah Alert. There are different ones coming, but that would take a different team lead. I don't want to speak to their, because they're probably cringing going, it's already here, you know, so.
Well, and can you explain what they do different? Like, why do we have different ones? Are they for different purposes?
Yes, get the team lead for that one. I'm not touching that one.
Okay. Okay.
We have so many different teams doing different things, and I don't know the dates of when they went in force. I know the AMOCA's are already in force, and we track people by video. The high-risk people are tracked. In isolation and quarantine, there's tracking with telephone calls. And then for people who are higher risk in those arenas, there's I'm getting messages, sorry. There's tracking for that. When we get boluses of cases, it's a little more challenging to reach out and do the phone calls as timely as we would like.
Okay. Can we speak a little bit to the people who do test positive? I know early on there were a majority of people were asymptomatic, and they were just they were through the contact tracing. They were identified, tested, and it was realized that even though they didn't have symptoms, or perhaps even symptoms that were so mild, they kind of just thought that it was allergies or something.
Sure.
Yeah. Are we still seeing that same number of or percentage or rate of asymptomatic people or people with mild symptoms?
Okay, so what you're asking me is, for example, of the 136 last night that were just reported, what are their symptoms?
Well, what are their symptoms,
Yeah.
or if they're asymptomatic, no symptoms at all, like overall?
We have 136. I'm reading it like you are. I haven't called 136 people this morning to say what their symptoms are. So the contact team will do that. Well, I can speak to the past somewhat. When I look over their charts, because if they're positive, they're in isolation. And what we do is we go over their symptoms when they're called for contacts. And so I can tell you that percentage-wise, I would say maybe, wild guess, maybe 20% are without symptoms. I don't want to say asymptomatic. People may not understand that, but about 20% have no symptoms. And that includes people who are contacts, and that includes people who thought, hey, I just want to roll the dice and see if I've got it. Sorry, these messages. So about 2/3, maybe 80% with symptoms. And the symptoms range from mild headache, runny nose, congestion, cough, fever, shortness of breath, nausea, vomiting, just mild cases. The really sick ones are in the hospital. Okay. So we get the no symptoms, which is maybe a fifth. About 4 out of 5 people, they said, have mild cases, and that's probably what we're seeing.
Okay. Ma'am, when you're talking about the symptoms and testing, there have been a bunch of folks who tried to get tested, but it's not too easy to get tested at the local clinics. Can you speak to?
I haven't heard that, so I can't comment on that. I didn't know it was difficult. Okay. Yeah, I didn't know that. It seems like everybody's getting tested that wants it on our end, so I don't know about that.
Yeah, well, we've gotten folks who've called because they were worried, that
right.
they might come into contact, but at the clinics they're told that they're not, because they don't have any symptoms, that they're not sure if the person who they came into contact with was positive. They're told, not to get tested. But what is the policy, right now? What is the policy that public health and the clinics are operating under? I
don't know about the outlying clinics, but we're testing anyone who comes in for it. If they want it, we test them.
You're talking about the northern and the southern?
I think they're doing scheduled. That's, again, a different team because they were overrun when we just opened it up. So I think it's more scheduled now.
Okay. Yeah, and that's fair. I mean, you gotta have some semblance of order, yeah.
Or else we end up with the same backlash we got when we said all comers, you know, and then you end up overrun. Right. But you never know when you throw out the grass seed, you don't know what's going to grow. And sometimes you have 200, sometimes 1,000.
And the number of tests that have been, that have been administered since March we're at well over about 30,000 now. And can you, of those, how many are there have been a bunch of negatives, but we've also talked to folks who've gotten tested and tested and tested, always showing negative, and then there's a positive, you know, maybe a day or two later. Can you kind of speak to that?
You're saying somebody who's been retested?
Who's tested negative, and then tests positive. And, you know, in some instances, there's not been a change in the routine. There's not been a change in, you know, where they go. They've been at home for the most part, continued social distancing. You know, how many of those tests have shown to be true negatives, and, you know, there
is no test. There's no test for that. True negative, true positive, there's no test for that. When we get a positive, first of all, it's about a 14-day window we're looking at, and there's a curve. So if you're too early, it may be negative. If you're too late, it may be negative. The sweet spot's somewhere in the middle. So you can go in on day 4, be negative. Half hour later, six hours later, you can be positive. It just depends on when your viral load in that swab is enough to register. As far as, so you can be negative then positive, you can be positive then negative within a day.
And that sweet spot is within about what, 5, 7
Usually
days?
5 to 12 days.
Okay.
Of the 14-day cycle.
Okay. And so folks who've gotten tested maybe 2 weeks ago, if they still don't have any symptoms at this point, then they can be fairly comfortable knowing that they probably don't have it.
Correct. If you think you've had an exposure and you happen to shut down for 14 days and you watch for symptoms and nothing happens, you're probably okay. By day 15, probably okay. We feel comfortable after a 14-day quarantine to say, okay, you're clear. And if you had it, you probably had a really mild case, and we've seen those. We've seen, like I said, about a fifth of the people, I'm guessing, that said, I didn't feel anything. And that's the way to do this virus, is shut down and feel nothing. You're the lucky one. And if you have a mild go of it, I mean, some people have had headache and runny nose, totally tolerable, but they wanted to be checked. They felt they had an exposure and they had a very mild course of it. So that's the way to do it. And it looks like you might be protected for a few months after that, but maybe not longer.
So you could probably get it again, just not within.
That's new news. I think it was a case in Hong Kong where someone developed a new strain of it. So it's mutated a little. They did gene studies and said this isn't good news because it will make a vaccine more challenging. Because if you think you have a target on, you've got a target and you've got your crosshairs on it, and then it moves. Testing. You can be with symptoms, without symptoms. You can be positive today, negative tomorrow, negative today, positive tomorrow. False positives. Who knows? There is no test for it. This is too new. We haven't had the years of research that goes into this. So it's evolving, and we have to keep pivoting as it pivots, as our community pivots in their responsiveness and their responsibility. We have to keep moving, and we're following a moving target. Now, what if you're positive right now? And you said, what does that mean? 3 main categories. You're a carrier with no symptoms, possibility. False positive, possibility. Or are you a repeat positive from an infection you had in March and April, and the crumbs left behind, that was a word that Chris used off KUM. It's a good term. When you destroy the virus, some of the inside, the RNA is left behind. Well, it's not alive or dead. We don't know. It's just, they're dead fragments left behind. But when we test it on the machine, it picks up those fragments. And so when you ask the machine, is that dead or alive? The machine says, I don't know, I'm technically limited. All I can do is tell you it's there. Certainly if you have someone sick or who has been sick before, it gives you some more history. If they're currently sick, you assume it's new. If they said, I was really sick by about 2 months ago, they're probably a repeat positive, and it's picking up the dead fragments because the machine just picks them up. It can't give you any information beyond the fact that it's there. And you have to piece together the clinical picture and try to make a decision. If it's the first test, we treat everyone like it's new just to protect everybody.
So Doc, as a layman, you know, as a member of the community, you know, if I'm not feeling well, or, you know, if I start getting sniffles, you know, what do I assume that it's a cold, or do I just automatically assume that it's COVID?
Right now with COVID flourishing, I would assume that you're at risk for COVID. But it is flu season, so it could be either, but there are tests for the flu too. GMH and our lab can run flu tests too. And so early on, we ran both. We ran to see if they had the flu versus COVID.
But I imagine now it's just, you've been inundated, you can't do that anymore. Okay.
It's more important to focus on the COVID right now because that's where all of the attention and all the disability is occurring.
Ma'am, I think the final question that I have is, at some point, I don't know that COVID's going to go anywhere. How do we, you know, has there been discussion on how we live with it as a community, and not just locally? I mean, because I know CDC is here. Has there been discussion on how we live with this as a global or regional community?
It's too new. Has it been mentioned? Of course. You're young. I've been around a while. I've never seen anything like this. It's a new and rapidly emerging virus, and all the fallout is new and rapidly emerging too. And so what you've seen in the community is correct when they say, we keep changing the policies, we keep changing the protocols. That's because we're always a step behind reacting to what's happening in the community and what's happening with the virus and what information we're learning. I mean, information we had a month ago has now changed again. We keep following a moving target. And if it will just sit still and let us fight it, it would be so much easier, but it's not playing ball.
Okay. Because as new studies come out with new information, you have to adjust. As new numbers come out with more people who are sick, how they got sick, why they got sick versus
it all has to be developed. Yes, absolutely. And you know, early on too, we followed CDC guidelines. They said once they're positive, do 2 negative tests and then you can release them, you know, retest them. Well, all of a sudden those tests came back positive everywhere. And CDC said, okay, stop. And then South Korea did some studies. They had some repeat positives, but the people were fine. And they said, what is this? So South Korea said, let's send that sample off and see if it grows anything, because that may be dead virus. And it was dead virus. They sent it off, grew it in the lab, and it didn't grow. So they said, oh my gosh, some of these, the machines are picking up pieces of it, and the people were no longer sick, no longer infectious, but the crumbs left behind are testing on the machines. And that hasn't been sorted out yet. So, I mean, so now we know that it hasn't been sorted out in the sense the machine can't tell you if it's dead or alive, but you can look at the patient clinically. You know that they were sick 2 weeks ago, and there's no evidence currently that people are infectious after 10 days. So that's good information. So we don't test anymore. The guidelines tell you not to, but we stopped it 2 months ago because we were already seeing that, and it was not relevant. And it's a little challenging too when the employers, we give them a clearance and then the employer asks them to be rechecked and they're positive again and they won't take them back in. There's no science for that. Everything the governor is doing is based on scientific evidence and what the CDC is saying to do, and then putting out local fires. She looks at the evidence and says, okay, we're going to move in this direction, but if my community surges, we're going to shut down, reboot, and start over. We have to get control of this. And often when things happen rapidly in medicine, you have to shut down, get control fast. You have to overcome. If you're ambushed, you got to overcome. Stop everything, put the fire out, and then regroup and get a new plan, move in a new direction, or with new realization that we cannot let our guard down. I think that's been pretty evident. Early on, we had this right. The community rallied. We were down to 0, 1, 2 cases and really enjoying that. But the luxury ended. We opened up.
Because the CDC has just recently changed quarantine policies. And I think with a lot of the cases that, especially at the beginning, the cases that we did see were cases that came in from off island. And short of closing the airport, right?
CDC's policies were changed for international travelers. And so they were opening the doors to the international travelers because...
You're talking about the 14-day quarantine and removing that quarantine requirement?
Well, the U.S. is in a mess. How can they require somebody from FSM to come in there and quarantine when FSM's at 0? And the states is, oh my gosh, numbers. Why would they tell them to quarantine? They're taking a risk going to the states. So it's for international travelers. And what they do, I don't really care, because we have to do what's best for Guam. If you run out of ventilators in Florida, you can drive over to Alabama and pick up a few. Where are we going to go? We have to do what's best for Guam. And I can't imagine anyone even traveling here right now. Look at the numbers. The territories are the worst. The territories and the islands are leading the band. So, you know, it makes no sense. We can't take any more, though. I don't care where you're coming from. If you're from a 0 area, welcome and travel at your own risk. But we can't take any more. We have to protect ourselves. We're on a rock in the Pacific. So certainly the plan you have in Alabama or Atlanta, Georgia has to be different than what we do in Guam, with limited infrastructure, limited personnel, limited manpower. And can we get it? Absolutely. It's going to come by boat or air. And how long will that take? We're not in a situation to follow what the 50 states are doing. Or the 48 rather. The mainland has a lot more capability than we have on a moment's notice.
Well, I mean, and certainly the CDC has taken note of that. So has Connecticut.
CDC. Let's be real clear about CDC. CDC offers recommendations and guidelines. It isn't regulatory. So what we've done in Guam is we look at those and we never drop below their metric, but in most cases we've been above it, because we have to tailor that to Guam. Sorry?
Can you give us an example of that?
Sure. When they would say quarantine for 5 days, we would quarantine for 10. You know, just we would add a few more days to it. Right now, they're relaxing quarantine in the States. We're not. We have to tailor it to what's going on here, and the governor watches all of that. And it's of little interest to me what they're doing in California when I'm in Guam on a rock. And we know our resources and what we can mobilize rapidly. And there are backup plans, but you don't want to have to use those.
Right.
We want to control it without having to do emergency measures. We let our guard down. We did it right. We did it right in the beginning. We let our guard down. We've seen now what can happen. It's time to go back to plan A. It worked. And our community can do it. We've done it before, and we can be proud again as a community to have numbers that make people feel welcome to fly here. It can be done. Surge capacity, testing, tracing. We've got the capabilities. Hospital is maxed out right now. We're looking at opportunities to open new units to try to help with the overload on the staff there, and trying to mobilize forces to get back up in. We're managing the surge, but it's going to take the front line to do their due diligence. And it can be done. We saw it before. I'm not speaking out of turn. We watched it happen where our community shut this down. We've got a great community and we care for our neighbors and our brother. That's our culture. We need to recapture that, realize we can't relax. We thought we might be able to lift the Band-Aid a little. Didn't work. It's a little too early. And we're learning from mistakes, we're learning from successes, and we're learning more about the virus as it unfolds. And the governor is making decisions based on CDC guidelines and recommendations, and then overall, what is best for our community. And tough decisions coming out of that loop, but they're trying to shut it down as much as they can and gain control again. That's the primary focus right now, is stop everything, reboot the computer, reset, and let's go back to where we were before. And we've got proof we can do it. We already know we can do it. We did it. But we thought we could edge up a little and relax a little, and it was too soon. And we've learned.
Just a real quick question on that, or actually if I can get your reaction to the question that people have is there a way to balance this? Because people still do need to work. We still need to
balance what?
That provides.
Go ahead, balance what? Do you think it's safe to open up right now and go back to work? What do you think? Do you think it's safe?
Well, that's my question is moving forward.
Mine too.
It's
ours too.
Do this as
you tell us where we'll be in 6 months. You know, this is just now happening. We have no vaccine. If there's a vaccine, that'll change things. If it just goes away, that will change things. That's my question for you all too. There is no crystal ball here. You're watching it. You're young. I started off saying that. I've never seen this before. None of us have since 1918. Is there a balance? We're all about to find out. Ask me in 6 months and we'll look back and say, hey, there was a balance. You know, those questions cannot be answered right now because it's like seeing a fire burning all over California and someone says, hey, how long is this going to burn? Well, there are a lot of moving parts to that answer. And the fires are burning, they're blazing right now. Where it's going to go, only time will tell. But can we bring in water and put the fire out? Absolutely. Shut down, stay home, and socially distance, wear your mask, wash your hands, do everything you can do because quarantine and those measures shut it down. People need to work, but guess what? They need to live too. If they catch this, they may not. COVID is coming for you. Make no mistake about it. COVID will find you. I don't care who you are. And if you're 20 to 40 years of age, God help you. Look at the numbers. It will find you. Shut down now. If you have a test, don't move till you get it back. If you think you're at risk, use your common sense. If you think you're pregnant, don't drink until you get the results. If you think you have COVID, don't make other people sick and die till you get your results. Common sense. Frontline. Frontline, the protective measures we've suggested in quarantine, that is Guam's vaccine right now, and having a governor who makes the dreadful decisions for the community to have to shut down knowing she has no option. All those parts go into saving our community. Jobs, I hope you live. What good is it if you're sick and disabled because 20% of the people may have permanent disability from this? You don't just get over it like the flu. There's chronic fatigue that we're seeing for months, chronic headaches, not being able to breathe. One runner said, I can't even walk across the room with permanent lung damage. Jobs, I hope you live. I remember asking my husband, a Vietnam veteran, one time I said, how did you brush your teeth when you were in combat? And he looked at me shocked and he said, brushing them, I tried to save them. You didn't want them shot out. And that's where we are. I mean, jobs? Are you kidding me? I'm afraid that people are not going to make it. It won't matter if you're on a ventilator if you have a job. You know, I said, instead of fighting for constitutional rights, you better focus on surviving this. It ain't over yet. And if you want rights, why don't you look at making a living will and what your wishes would be if you can't breathe on your own? You better be looking at that right now. Constitutional rights and your rights for freedom and restriction of movement. If you want to go do what you want to yourself, do it, but please don't bring it in on us. We can't handle it. So a lot of moving parts to that, and I'll know more. I can answer that better in a couple of months, but you will too. I can answer it when you see it too. But we've got to put the fire out now. And we as a community did that. So we implore the community to do what you did before it worked. Right now, how do people eat? How do people pay bills? That's a question everywhere. I just hope you're alive that you can do that. I hope that you're alive in 6 months and can go back to work and not disabled, and you survive this. That's a bigger prayer right now.
Well, an emphatic statement, an emphatic plea. Thank you so much for your time, ma'am.
Thank you. But we'll know more as time goes on. You're going to see it unfold as we do. And every decision that Adeloop makes, every decision public health makes is following the virus and tracking the progress and the regression that we see. We are constantly moving. What can we change? Sometimes we've even changed a protocol one night and the next morning we're like, I wish we had done this, but we can't change it this quickly because we just changed it last night. It's moved that quickly. And we regret it. What do you do? You know, we're doing the best we can to try to keep people safe, keep them alive, and all the other issues, very important. But when survival's in the lead, we've got to survive first and take care of those other issues as we can. And we will. We'll make this. We can make it happen. On the strength of what I've seen in the past and what we've seen, what our community did in the past, we'll make it. We can do it. We have the resolve. We're Guam.
We are certainly Guam. And for Team Guam, we say thank you for your time, Doc.
Viva.
Have a great day.
You too. Thank you.